I am Dr. Abhijit Lonari, Orthopedic and Joint Replacement Consultant, Aditya Birla Memorial Hospital, Pune. On occasion of this World Arthritic Day, we will have a quick overlook about the arthritis, its management and prevention. So what are the preventive measures? Of course, one is exercises. Second is you better cut down some of your weight. More the weight, more chances of getting arthritis earlier. Third, some lifestyle modification are essential. We avoid frequent sitting on floor, squatting. Rather, we have a chair life. Fourth is do regular vitamin D, calcium supplements. Keep your bones healthy and strong. And fifth is cut down some bad habits like smoking. It does affect your joint and the bone health. Now once the arthritis is set up, now we are moving towards more and more preserving our joint. So of course we know at one end it is the joint replacement. When the joint is too bad, we will have to go for joint replacement. Now joint replacement surgery is very successful surgery and we do it day in day out. There are a variety of advancement in the implant material, the techniques with which we do the surgery, and so we have a much better result nowadays with the surgery. But beforehand also we are moving towards preserving our joint. So smaller injuries, smaller cartilage defect, we better deal earlier with the investigation and maybe arthroscopy surgeries. So if we prevent the minor injuries, we will prevent the late stage arthritis, or we can at least lengthen the late stage arthritis. In between, we can have some injections also inside the joint. Again, there are a variety of injections available. But in all of this, the most important factor which I wish to tell you is the preventive measures you should take, and the most important of the preventive measures is the exercises. So do exercise regularly and keep your joint healthy. All the best.